All right, let's talk COVID, everybody. So doctors are warning that the coronavirus may, in fact, lead to long-term heart complications at least 1 year out from the initial infection. According to a new study published in Nature Medicine, COVID increased the risk of heart failure by, get this, 72%, heart attack by 63%, stroke over half, 52%. Experts saying the risk for complications, by the way, it's everywhere. So let's get into this. NBC News medical reporter Erika Edwards is joining us now with more. This is a fascinating study, and I think incredibly concerning for so many folks now that have tested positive for COVID throughout this pandemic. Walk us through this study, Erika, some of the biggest findings that you're seeing, and are there any groups that are particularly affected by this?
Hey, Yasmin, good morning. So this was a huge study, more than 150,000 COVID patients studied, compared with more than 10 million others who were not infected. In addition to those risks that you just outlined there, researchers also found, up to a year out, an increase in high blood pressure, erratic heart rhythms, even blood clots in the legs and lungs. Now, the study was done using VA records, which meant a lot of these patients were white men. However, when researchers dug a little bit deeper, they accounted for that. They found that those risks remained regardless of age, race, or even underlying health problems like obesity. Yasmin?
You already see the crunch in the healthcare system across the country, not only because of this pandemic, but because of our healthcare system in general and how it's built. You now hear about this study and the effects of that and how we could see long-term effects a year out, 2, 3, 4 years. How are we going to see this affecting the healthcare system in the long term?
Well, it's a huge concern considering we've already topped, 77 million cases in this country alone. And what's more, the pandemic itself also led to increases in heart problems. A lot of people were sedentary. They weren't seeing their doctor as regularly as they used to. Doctors are seeing marked increases in things like high blood pressure and out of control diabetes, regardless of infection with and without prior COVID-19. Yasmin?
So what can folks do to avoid developing this type of complication?
Yeah, so the best thing is really to get vaccinated. The people who were infected in this study were all infected before vaccines were available. And the doctors I've talked with, who've treated these heart problems following COVID-19 infection, the majority of those have been unvaccinated. Otherwise, get back into your routine healthcare with your primary care physician. And above all, listen to your body. If your COVID-19 recovery is stalling all of a sudden, or you develop sudden new symptoms, shortness of breath or chest pain, those are red flags that you need to call 911 immediately. Yasmin?
Really important story, really important study. Erika Edwards, thanks for talking us through it. We appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.